time for our interactive session where we're going to have the phone lines open to hear your thoughts and your contributions on our topic for today. Now, today we'll be talking about the cost of medical services, and we'll be asking, do you have health insurance? Okay, now the cost of medical services in Nigeria can be challenging for many individuals and families. Medical care in Nigeria, especially in private hospitals, are expensive. Many people struggle to afford the cost of treatment, medication, and other expenses. Even though Nigeria's National Health Insurance Scheme aims to provide affordable healthcare to citizens, but the coverage is actually limited because we have few people who are fully aware of how it works and very few people who are enrolled, and even those who are enrolled, we have a limited number of those who actually use it. Now, some states have introduced their own health insurance scheme. So do you have one? Have you heard of one? If you're enrolled under any health insurance scheme, do you use it? What's the reaction from the hospitals like towards you when you go and you let them know that, okay, you're under a particular health insurance scheme? So the question is, do you have an insurance? Do you have a health insurance? How well do you use it? The phone lines are open. The number is right down there. So join the conversation. You could call us. You could drop a message via WhatsApp. We're here to hear your thoughts and your reactions. So, Son, did you have health insurance?
I do.
Okay.
Yeah, I do. But I rarely use them.
Why?
Now, the last health insurance I had was in my posting in Lagos. And upon returning to Abuja, I have not been able to pick a hospital. But that's just for me, not for me and the family. Because the family, especially the children, my wife would prefer they use a children clinic, that is a bit specialized. But that's for me. But I've never used it. But I keep getting that deductions at the end of the month. Maybe because sometimes you don't want to go through the headache of showing up in a hospital, going through all of that procedure when maybe walking into a big pharmaceutical outlet. But that's not the way to go. But really, that's been the practice for me. But it's a major challenge, and healthcare is damn right expensive. I mean, to treat malaria these days, it's anywhere in the region of 10 to 15,000. And if you have a family of 3, you are very sure that in a cycle of 2 months, each of them would have had to go through a malaria treatment, and you can imagine how much that takes out of the income of a household. So it's tough, it's difficult, and even with the health insurance, some of the complaints I get from my contemporaries is that it covers just very little. And then when you show up in some of the hospitals, the moment you say you are NHIS candidate, you get this kind of attitude that suggests that you are not priority, you are not they are not happy providing those services for you, even though they voluntarily signed up for it. They would rather over-the-counter customers where they can throw all kinds of charges at you, and you probably leave the hospital bankrupt on account of coming in for a treatment. So there are several experiences that are out there, that are not very palatable, that I'm sure the NHIS is very much aware of, and this would afford us the opportunity to hear some of them firsthand, but more importantly, to even discuss the issue of coverage, because as we very well know, a lot of people have heard about NHIS or even private health insurance company, but the question is, hearing about it, being aware about it, as they say, may not necessarily translate into using the services.
Talking about the coverage, I remember when I went to a hospital to register for maternal care, for the maternity ward, and they would say, okay, there's always this, like you said, there's always this attitude towards people who have, first of all, the first question, military or civilian? Civilian, okay, come this way. NHIS? No, please come, NHIS, wait here. And I'm like, why? Okay. But then moving on, if you're doing CS, your NHIS doesn't cover it, and then CS is like 300,000, 400,000, your NHIS won't cover it, your NHIS doesn't cover this and that. So what's the point of being under it when it's covering very little things for you and you can't afford? Those are the things that you really would want it to cover, the surgery and some other things that will tell you, no, it doesn't cover it. Your NHIS doesn't have money for that, or would rather you pay up front and then maybe with the NHIS cover, we'll see how we can refund you. And all of that. I saw this play out firsthand in the hospital. I saw other women complain about it, and they will attend to those of us who are here with cash payment or civilians, because it was a military hospital, so as civilians, okay, yeah, civilians, come this way, you have your money, do you have cash, go and pay, come back, you are sure to get swift service compared to those that are using NHIS. And I do wish I have health insurance to see how it operates or how it works, because one cost of medication is really expensive.
I will share my experience with my own father right here at the Federal Capital Territory after this first phone call. Good morning. Your name and where you calling from? Hello. Good morning.
Good morning. How are you?
I'm very well, thank you. Your name and where you're calling from?
My name is Shetima Yakudima, calling from Maiduguri.
Thank you very much, Shetima. How is Maiduguri this morning?
Maiduguri, Alhamdulillah, Mr. John.
Thank you very much. Please kindly share your experience with us.
Well, you are talking about health insurance scheme.
That's right.
To me, this health insurance scheme is an administrative 419. Why did I say so? Because if you are on NHIS, if you go to the hospital, the treatment that you receive is different. And sometimes, even the drugs, you realize that the expensive drugs were not available under NHIS. Only the cheapest drugs that you will find that scheme covered. I don't know why they are doing this. To them, sometimes they are not happy with you because they are seeing that as you are giving you a cheap services. And they fail to understand that there is a lot of workers who are paying these NHIS and they are not enjoying it. So some they did not even register. And to my surprise, I realized that there is illnesses which is money-consuming illnesses, and the scheme did not cover them. Why? That's why I call it it's an administrative 419. Because what you are paying is not what you are receiving. What you are enjoying is far away from your payment. Your payment is more expensive than what you are receiving from them. This is true, and something needs to be done. Because and the reason I don't know why they make it compulsory. They are deducting from the source. Why can't they leave it open? Whoever willing to join, let him join. So that if you want to join, then you join. But at the moment that you get an appointment, you have been registered under NHS, and your money will be deducted. And you are not receiving the quality services.
All right.
Thank you very much.
No quality services, honestly speaking. So something needs to be done. We are calling the Labour Congress to do something about it.
All right.
Thank you very much.
Thank you so much, Mr. John.
Thank you very much.
And have you a great day ahead. I mean, very straight to the point references to what the NHIS has become, and little wonder why people basically would not subscribe to it. On a day like this, I really wish we get to hear from Ade from London, who has stayed there for a while, so that we can compare notes between how the NHS London works versus the NHIS in Nigeria. Perhaps we can learn some lessons from there. We have another caller. Good morning. Your name and where you're calling from?
Hello.
Hello, good morning.
Good morning. What's your name and where are you calling from?
I'm calling from Toto in Nasarawa State.
All right, your name, please.
Can we have your name, please?
My name is Sadiq Muhammad.
All right, Sadiq, can you turn down the volume of your TV set and talk to us through your phone so we could hear your opinion?
I've done that.
All right, thank you, Sadiq. So do you have any health insurance? Tell us, what's your experience?
Yes, we work with the FCDA, Federal Capital Territory Administration.
Yeah. Go ahead, please, and share your experience.
Okay. We and this health FCT health service scheme. In fact, we are not enjoying the service at all. At time, if you go to most of the costly drugs that are supposed to be given, they will complaining that the drugs is not available, drugs are not available. They will just write it for us to go out and buy those drugs in the chemist. Instead of us to be enjoying the drugs in the hospital, we are not enjoying. And in fact, we are not enjoying services at all. Our money are deducting unlike myself, almost about 9,000 naira monthly that are deducted from my salary. And I'm not enjoying the service. I can stay more than 1 year without going to the hospital, myself and my family.
Thank you very much, John, for giving us that update. I was just trying to ramp up 15,000 over the back of my head. That will be way over. That's around 850,000 or more in contributions in a year, and to get those kind of terrible service. And he was referring to the FCT health insurance scheme, which is something similar to what some of the states have done, like Lagos State.
Yes.
They have their own health insurance scheme, which is somewhat a replication of the national health insurance scheme.
But is it different? Is the treatment of patients
some
different?
states, they have gone a little wider, looking at the peculiarities of their state. So for instance, if you are a state that is bordered by the issues of maternal healthcare and all of that, you want to situate your interventions. You would like your interventions to cover most of those issues, and if you want to pump in some kind of subsidy, that's the best way to do it. For some states, childbirth is absolutely free. Somebody is actually burning the cost. The government is, but you have to show yourself. For some other states, they even have conditional cash transfers. If you show up in the hospital, if you use the antenatal care and you give birth in the hospital, the government even pays you some money as incentive to encourage other people to want to take up those services. So some of them exist with one or two variations here and there, but generally the frame, the operational frame, it's about the same. But I mean, the issues are clear. The services are poor for those who are in it, and it speaks to why some others don't. If you compare the NHS and the private health insurance scheme, they are way better, especially.
No, I think the problem, even the private health insurance scheme still faces this challenge. And let's to the defense of the hospital a little bit. I was opportune to speak to some of the management of the hospitals, and they said that's because they don't get their money as at when due to cover medical services and running the cost of running the hospitals, which is understandable if you're running a business. So even if the private services are a bit better, but the private will always say bureaucratic reasons, that's why we don't make this payment in time. But this is a business on the other hand. Hospitals need to be run, medications, doctors need to be paid, fuel and everything, diesel, it needs to be keep running.
It is difficult how you then translate whatever bureaucratic or administrative bottleneck into the way you now treat
your patients,
who is grasping for breath against time. Why not fix this and then continue to reconcile whatever you do back end? Otherwise, you just opt out of the services. Let us understand that the hospital is not in it. My own father came into this city with a nasal problem, and we went to the Abuja Teaching Hospital. You don't have a problem with the quality of service you get from the medical personnel, whether it is in how they check you and all of that. It is always at the administrative part.
Yes.
Where his referral would not be accepted except they get some kind of intervention from somewhere. It's the same institution that tells you can get a referral to different places, you have documentations, but they would not honor it. They would rather you do certain things in cash.
Right at our school, yeah.
Good morning, your name and where you're calling from. Hello, good morning.
Good morning. How are you?
Very well, thank you. Your name and where you're calling from, please.
Okay, this is Wale speaking from Ogun State in Ilishan, precisely.
Good morning, Wale.
Ilishan Remo.
Yeah, Ilishan Remo. That's where you have the Babcock University, isn't it?
Okay, you guess right. Yeah. I'm actually a Babcock staff.
I am a former student, or rather I abandoned my studies somewhere midway because of relocation, but I know the town very well. Good morning and thanks for joining us. Your opinion, please.
Good morning, but I encourage that you should come and finish it up. Probably you can work on an online study. You will really enjoy it.
Yes, we started with the online thing, but this job will just not keep me in one place. So, but I will explore that. Thank you very much. Please, let's have your opinion.
You are welcome, sir.
Yes.
Yes, I'm interested in your program.
Okay.
And especially the health insurance scheme. And I thank God I have my own NHIS.
Fantastic.
But my question is, how do we upgrade for our children that have been registered in it? They are above 18 years old now. So how do we upgrade their NHIS so that they can continue to use it even after passing the age of 18 years?
Yeah. But what has been the experience for you with regards to the quality of service? I know right there in Babcock you have your teaching hospital, and I know how fantastic that, at the risk of advertising what goes on there, but give me a sense of how much you have enjoyed these services with regards to availability of drugs, with regards to prompt and efficient service delivery.
Yes, I want to say that my own, I selected Oyo State, UCH, as my own center. Because I'm thinking of retirement. When I retire, I'll have access to that place. I do not use much of NHIS in Babcock because Babcock operates its own health scheme.
Yes.
But my experience with it is that in UCH, at least one or two of my children have really enjoyed the NHIS at UCH, and they were given prompt attention. I wouldn't know whether they were able to quickly receive the funding back, but there was not a time when we wanted to use the NHIS in Oyo State that we were stopped, except I know from my own knowledge that one may not be able to use it if it's beyond what the NHIS can take, like an operation or cancer treatment or what have you. Even a cancer treatment, there was an adequate attention given to such patients. That has been my own experience.
Okay. Thank you very much, sir. The question you asked, I'm sure, probably along the line we will get some NHIS staff call and help provide clarity around the question you asked, which is around upgrade. Otherwise, we can confirm through other channels and we'll share the information with you. So please stay tuned to the program.
Thank you so much. I enjoy listening to you. And then how can it be made available? My second question, how can it be made available for people that are not federal workers or state workers, especially the artisans and the other forms of people?
Yes.
What are the opportunities for them to have any child?
All right. Thank you very much. If you stay tuned, we have a panel of experts who will be coming up later in the day. We would explore all of these questions, and I'm sure we will find some answers. Thank you.
All right, I think this is a different one. He said that they enjoyed prompt services. It's different from what other people have also called. And just like you mentioned, the ones that happen in states are quite different from the national NHS, and then the private ones are a bit different. But I think the problem comes from the attitude of the hospital and the administrative staff. Because as for the services you receive from the doctor, he will treat you, he'll attend to you, he will prescribe medications for you. But at the administrative point is where the problem comes. Let's quickly take this call. Hello, good morning. What's your name and where are you calling from?
Hello, good morning.
Good morning. What's your name and where are you calling from?
My name is Tones. I'm calling from Otuko.
All right. Go ahead. Do you have any health insurance? Are you under any health insurance scheme, and what has your experience been like?
I'm not any, but one of my closest person is under insurance.
Okay. Please go ahead and share your experience.
And the truth of the matter is that it is only little things that they can handle. Sometimes if we come in the one that we involve in a bigger amount to spend, you see them dodging it. Like the person that I'm talking is having diabetes. And then there is a little wound in the leg, and it continued to escalate to the extent the doctor said that if we refer him to another hospital and say, let him go there, that the only option is to amputate the leg. This man go to another hospital and the leg was treated and it's okay.
Wow.
So what the insurance in Nigeria, not only in the health sector, the insurance is not okay. The motor we are using every year you renew your insurance, but if anything happens to your motor, they will not come to your aid. And the government insists that when you renew your paper for insurance, you must pay huge amounts to insurance company. So in Nigeria, how things work in Nigeria is unfair. All this insurance, they are there just collecting money without giving services to people. I'm not blaming the hospital, because if they are doing hospital well, hospital will attend to people. But the problem is with the insurance, and that's the simple truth.
Thank you very much for that, and I cannot agree any less. There's a problem with the NHIS administration with regards to prompt payment for service already rendered. There are also questions, no doubt, about the attitude of hospitals and the manner in which they respond to these administrative delays. I mean, it is not the fault of the person whose money has been deducted.
Yes.
And let us understand how this works. It's a concept where everybody contributes to a pool so that the few persons who get sick get the best of service. So it is not exactly a question of whether or not there is a fund available for this or not. It's a huge fund. I mean, if the NHIS was talking to us regularly, we would know how big this fund, the size of this fund has become. Over the years, there are people who have contributed for 5 years and have had no need or never had any need to draw on those calls. So these are huge baskets. So the question is, how do we move from the size of these baskets to the quality of service that people get at the end of the day? Good morning. Your name and where you're calling from?
My name is Victor. I'm calling from Makurdi.
Good morning, Mr. Victor from Makurdi. Please go ahead and share your perspective with us. I would need you to please shut down the volume of your TV set and talk to us directly. Mr. Victor.
Yes, good morning.
Good morning.
Yes, on this issue of a health insurance scheme, like myself, I'm on NHIS.
Okay.
And my experiences with NHIS has been very, very, very disappointing. Many a times you will go to the hospital after the consultancy, the drugs, they will not administer drugs for you. They will write the drugs for you to go and buy. And that is the treatment. When you're on the NHIS already, your money has been deducted for treatment, and after the consultancy, they will now write drugs for you. You have to go and buy drugs, almost 15,000-20,000 naira. So what is the NHIS? Because the drug is the treatment, it's not consultancy. Consultancy is just to diagnose what is wrong with you. But to administer the drugs, so they are not always having the drugs.
Let us get it clear. I know of people who use the NHIS services, but whatever is written for you as the drugs you will need is costed, and you are meant to pay just a percentage. Are you saying in your experience you are meant to pay everything, or the costing is not even done at all?
They will tell you they don't have those drugs that you have to go and buy outside.
Wow.
Ordinarily, they have to cost it, and you pay 10%.
Yes.
But they will tell you outrightly that they don't have those drugs. It has happened not once, not twice. I'm even telling myself that one of these days I'll have to visit their office and let them know. As most of those, it happens in my hospital. It happens in the hospital. My wife is also on NHIS in our own hospital, and that's what they are doing now. Wow. They will never administer drug for you.
Wow.
They will never. They will only do consultancy, and they will write drugs for you to go and buy.
And who knows, in making their claim, they would have also included the fact that they provided drugs. I'm just saying.
Yes, definitely. That they provided drugs for you now, but they will never, those drugs are not always available. Wow. You have to go and buy.
Interesting. Thank you very much.
Thank you very much.
I'm grateful.
Yeah. So it's one thing to have your money deducted regularly for medical services, which should include drugs. Like he said, if I wanted consultation, I'll go to a random hospital and get the consultation. And the major thing is the drugs to be administered. And then you're telling them that you don't have it. even if they've already paid for it. This is not a free service. They have paid for this and they need this because this money has been taken from their salaries. But let's quickly take this call. Good morning. What's your name?
Good morning.
Good morning.
How are you today?
We're very well,
fine,
thank you.
Hello, my name is Adi. I'm calling from London.
Good morning, Mr. Ade. Thank you very much for yielding to my requests at the beginning of this program. But please go ahead and share.
I've been trying your number since you started the program, but it's not going through because of network.
Yeah.
Okay.
Some of those challenges in Nigeria. Thank you very much. Please go ahead.
My view about this is that the program of NHIS in Nigeria is a very good program, very good, whoever introduced it. But these things cannot work automatically. Why? Because our character, our honesty, or dishonesty, should I say, and reaction to so many things. A caller said something, which is very important. He said they are not sure of getting their money. So government should regulate those things that their money should come from central bank directly to the hospital, so that they will have a guarantee that their money, they will receive it. What we operate in UK is, we call it national insurance. Yeah. Once you started working, you will pay little money for national insurance. So that guarantees you free health care. And we don't go to hospital here, except something is serious. Every area has a health clinic. We call it clinic, we call it health center in Nigeria. Like I have one by my street here, which is about 5 minutes walk. So in my clinic, I do attend meetings and sometimes with them. We have about 50,000 patients, but they don't come like that. And we have so many doctors, ultrasound. The only thing they don't do in my clinic, there's no admission. But anything you want is there. It's a big place. And you have so many doctors. Last time I visited the place, I was told that which doctor do I want. They started mentioning their name. When they say Dr. Okoro, I said I want Dr. Okoro because I know that one is in Nigeria. Not because others are bad, but I just want to feel it. And when I went there, I saw her, and we laughed, we shout together. It's an Igbo lady, but we were, getting along together. That's by the way. So that's how it works. But here, if you are working, and you go to your clinic, and they give you prescription, you have to pay for it. If you are not working, you are unemployed, you won't pay for it, it's free. And if you are pension, you have reached the age of pension, you've retired, that is 60, and any medication they prescribe for you is free for life. But if anybody is sick, either you are employed or you are not employed, and you are admitted in the hospital, you don't pay a dime. Either they give you drug or whatever the treatment, you are covered by NHS. All treatment is covered. Nothing segregated at all. If you go to hospital, they take care of you fully. But if not hospital case, you went to your side clinic, which is health center in Nigeria, then if they give you a prescription, and they will write it there, are you working? If you are working, then you pay. If you think you are not working, they won't check anything. They will still give you free, even though you are working. Some people will do that, which is not honest anyway. But but we can't get to that level yet in Nigeria because of the system, the bureaucracy. So how will the hospital get their money? Is it guaranteed to get the money on time without paying percentage to some people? So this is what is happening. You understand? By the time we get there, maybe in another 10 years or less, then things will flow, easily with everyone. So I can understand where people that are complaining right now. It's a good policy, but dishonesty is affecting us. Lack of trust is affecting us, and the bureaucracy. So that's why what we are enjoying here. Initially, before, you can come from Nigeria, you go to hospital free, but now they change everything. If you come now as a foreigner, you pay. Okay. Before the hospital admits you at all, they check your details, you pay. So they don't longer allow that anymore. It's only for people who are resident in UK. That's what is allowed. So because the NHS is free, it's costing a lot of billions and billions of pounds from the government. It's the central government that pays for it. But the health center is for the local government. They have so many health centers where you can go book online, get your prescription, all this sort of thing. So that's how it works. I pray Nigeria will get to that level and even pass that level.
Thank you very much, Ade.
God bless Nigeria.
God bless Nigeria.
Thank you very much.
Thank you, Ade, for that short but very inspiring narratives around how the NHS work in London, which should be what we should aspire to. And we have been there long enough, to begin to learn how things are done in other clients, especially the positive things. And he talked about how the system works, how the hospital is not inundated with every case, but you could still see a professional get prescriptions, and then when it becomes something that will require bedding and all of that, you are then referred to the hospital. But a nice, process there, something we need to learn. And as we have said, there is a marked difference between the NHS and the ones that are run by the private firms in terms of how you are received, the quality of service, and all of that. We'll take our last call before we wrap up on this one. Good morning, your name and where you're calling from.
Hello, good morning. Okay, I think we've lost that caller. But before we wrap up, I love what he said about, being able to visit clinics and not letting the hospitals get crowded up. We know the state of our healthcare centers. Number one, we know the attitude of the medical practitioners that are there, and Nigerians don't even trust it enough to go there. So I think it's a long walk for us.
I don't know where we lost that trust. I think it started when people show up in those places and you can't get drugs. Then it graduated to when you show up in those places and you can't find doctors, or you find a single doctor attending to over 1,000
people.
And then people started, the disaffection for that system started growing, and somehow the lack of funding to local government and the rest meant that they were not getting subvention, and before you know it, they became a shadow of themselves. There's so much to be fixed as far as our health systems are concerned, and health insurance is one way to guarantee quality health services for the greatest number possible. If we understand that concept, really, it's about everybody, because everybody cannot fall sick at the same time. So it's about everybody contributing to a pool so that a few persons can get quality service at a time. So the staff was saying he gets these deductions are up to 15,000. If he never shows up in the hospital for 1 year, that's 15,000 contribution for the benefit of some other persons who may be his distant relative or whatever you, however that works. So it's something that has to work. It's something that this government needs to review. Some introduction of IT can be very supportive, so that there and then when you are offered services, the hospital can send you a mail indicating what services they are offer, and you can corroborate it and it goes straight to the health insurance to tell whether or not you got satisfactory services or not, and that could be very useful feedback for these people to develop the program. And that's the much we will take on Daybreak Interactive.